We're delighted to have with us today Michael Vandenberg who is joining us from Paris, the city. He is a health policy analyst at the OECD with over 2 decades of experiences in healthcare policy and research. He is leading the Paris initiatives that he will present today, which is an international effort to shine a light on what matters most to patients and improve the way the health system works. And Michael's work has focused on turning evidence into action and helping countries learn from each other to deliver better and more people-centered care. We're delighted to have him with us today for a second time after his first talk in 2019 when he presented the premises of the Paris survey, and now 6 years later he returns to present the main results of these international initiatives in a talk entitled, Does Healthcare Deliver? One last thing, we will take the questions at the end of the talk in English, if possible for you, and if not, then I can translate. Michael, the floor is yours.
Yes, setting my timer just to be sure. Thank you very much, Chantal, for this introduction. And yes, you're right. It's been a while that I was talking to people in Switzerland about Paris. And the great thing now is, and that we are all very excited about, is that in February we launched the flagship report titled Does Healthcare Deliver? With the results of Paris. And this question is not only the title of the report, but it's a very essential question in the whole Paris initiative. Because the question is, well, does it deliver? But what is healthcare actually supposed to deliver? Just a little bit about the logic behind the Paris project. Yeah, as a reminder for some, and for some maybe as something new. The thing is, healthcare, just think about healthcare, what it's supposed to do. It seeks to improve people's well-being and support them in leading a meaningful life. And it's surprising actually that we know very little to what extent health systems are successful in achieving this. Because we're measuring a lot of things, like healthcare is a very data-rich environment. Also at OECD, we have a ton of data on hospital beds, on doctors and nurses, and prescriptions and admissions and life expectancy and all these things. And we have a lot about inputs and processes. But even though most people agree that healthcare is all about patients, we rarely ask them systematically how healthcare impacts their life and how they experience it. And this is the reason why ministers in the OECD called on the Secretariat on the OECD to start this Paris initiative and to start building an international system to collect patient-reported outcomes and experiences. Now, we can say we're setting an international standard for patient-reported outcomes and experiences. Paris has now completed the first cycle with 107,000 people using primary care, age 45 years and older. In Switzerland, we have 4,178 in our analysis, and there are 1,800 primary care practices, of which 140 in Switzerland. And as you can see, 19 countries have participated in the first cycle. So important to understand here is that we're not talking about a health survey, a population-based survey. It is a patient survey. So we are measuring experience and outcomes of actual users of primary care. And we are particularly interested in people who live with chronic conditions, because in everything we measure in healthcare, we tend to be a bit obsessed with hospitals. And that is super important because there are important things happening in hospitals, but actually most of the healthcare is taking place outside the hospital walls. People with chronic conditions are managing their healthcare every day. And they often go to primary care settings where their conditions are being managed and where they are being supported. And this is really was a black box. We didn't know anything about this. And the interesting thing, this is actually the most rapidly increasing group of healthcare users worldwide, definitely throughout the OECD. So this is what we are looking at in the Paris survey. Now, Paris was not just created in Paris, the city, by the OECD. We have been facilitating this process, but Paris was co-created with experts and stakeholders across the world. Well, you might think he was here 6 years ago. What took them so long to complete a survey, right? Well, we have used this time not just to do a survey, but to build an international community of stakeholders. We have a very strong patient community, for example, a patient panel with patient organizations who have been involved in every step that we took in the development and the implementation of the survey. The same for healthcare professionals, policymakers, academics. We have an expert group of leading academics from all over the world who have been advising on this project. And you can find a lot of information on our website, where you also find the links to several international peer-reviewed articles, to the questionnaires and several papers, working papers, policy papers that we produce along the way. So for those who are interested in all the details, because, well, 45 minutes today, which is quite long, but it's just enough to scratch the surface and to share some results with you, and not going super deep into all the methodological aspect. So this has been the work of many, and not in last place, Switzerland. As you can see here on the left side, the organizations like Unisante, Ecom, and so on, who have been involved in the implementation of this project in Switzerland. It was commissioned by the federal committee, which you see on the right. And also important to realize that it's not just that these organizations like Unisante has implemented the project in Switzerland, but they have been contributing also to the project on an international level by participating in international meetings and advising on how we're going to design the survey. At the bottom, you see a number of also patient organizations who are supporting this in Switzerland. And Switzerland has also a website that you can find here for those who want to know more about Paris in Switzerland in particular. Then a little bit about the content. So what did we measure? Well, what you see here is what we call the Paris 10. And there is much more in this survey, but in the flagship report, we chose to select 10 key indicators that serve a bit like the backbone of the report. So throughout the report, we follow these indicators and we'll look at them from different angles. And on the left side, you see the PREMS, patient-reported experience measures, and they show how people experience healthcare, how they experience the communication, how it's coordinated, but also the trust they have in the health system. And on the right side, the PROMs, patient-reported outcome measures, which refer to health. So the outcomes of healthcare, physical health, mental health, social functioning. So it's just following the WHO definition of health, well-being, and general health. And just to better understand this chart, it is a radar plot. So the line, what you see here, the middle to the outside, is the percentage of patients who had a positive score. You need to go to the report to find where the cutoff point is. There's a clear explanation of that, but just to get an indication of how these indicators relate to each other, the line at the outside is the highest scoring country. The line at the inside, the light blue line, is the lowest scores, and the orange line is average. And one thing that you can see here, for example, if we look at trust, that the range is much larger. So there are big differences between the level of trust that people have in the system from one country to another. Whereas something like well-being or social functioning shows a much smaller range. Well, an explanation of this is also that these are things that are affected by the healthcare system, but also by many other things. And we should not forget, we're looking at OECD countries. So on average, pretty wealthy countries, if we look at it from a global scale, where levels of well-being and so on are relatively good. Now, the question is, of course, how does Switzerland compare? Because that's what you want to know. Well, this year, you did a little bit worse than last year. This year, Austria was number 1. You were number 10. Well, interesting. However, Paris is no Eurovision, and health systems, I think, are a little bit too complex, too multidimensional to make simple rankings, why we do in the Eurovision. And I'm showing you this because I know that people love league tables. I know this is very attractive. And during the launch, there was also a question coming in from someone from Switzerland to ask, so does Switzerland has the best healthcare system? Well, this is a very difficult question to answer because Paris is not claiming that we're measuring everything that's going on in the health system. And that's also not the point of what we're doing. It's not a point to make, it's not a contest, right? It's not about who is the best and who is worse. The point is that we try to facilitate international learning. How can we learn from each other? How can we identify best practices? And I think there's just too many things going on to make rankings that are as simple as this. Well, I'm not saying it's simple in Eurovision, but it's definitely more simpler than in Paris. Having said that, well, how do countries then compare on at least the 10 indicators that we selected? Well, and here you can see we can make just something that might make people happy that do like the league tables, but still keep in mind this is only the Paris 10. And here, what you see here is the percentage of indicators that score above the OECD average, below or close to the OECD average, which means not statistically significantly different. And interestingly, Switzerland scores on 9 out of the 10 indicators above the OECD average and only 1 around OECD average. That one is confidence in self-management. So the question, how well are you able to manage your own health? Here, Paris, Switzerland scores average. And well, of course, you want to know, well, what is so exceptional on Switzerland? Well, I'm going to show you a few more results, maybe that help us answering this question, but I also hope that you might be able to maybe provide some, shed a bit of light on that later. Well, too fast. Here we have the radar plot again, and this time it's not about the average, OECD average. Now the line in the middle shows Switzerland. And as you can see on several indicators on the right, the outcomes like physical health, mental health, social function, well-being, Switzerland all scores high, so often the highest scoring country or close to the highest scoring country. And actually also on the experience side, it's doing pretty well. But the downside this type of chart is that the outside lines is always defined sometimes by an outlier. In this case, for example, for trust. But even there, the trust, Switzerland is scoring definitely high on this indicator, but not as high as Spain. And confidence self-managed, you see at the bottom, that's the one where you are pretty much in the middle. Now, a little bit more about the population that we have in this survey, because I told you we're interested in people with chronic conditions, but we are, for privacy reasons and practical reasons, it's not possible to sample patients based on their conditions, because then you would have to go into the medical records before you have their permission. So we sample people who have been in touch with a primary care provider. And what we found that throughout Paris in general, people 45 years and older, 82% lived with at least one chronic condition. More than half of them live with 2 or more chronic conditions. So also multimorbidity is a major thing. It's something that it's massive and it's growing. Even living with 3 or more chronic conditions is absolutely no exception. More than a quarter, you can see here, live with 3 or more chronic conditions. Well, we took the threshold of 45 years and older because we knew that if we would take that threshold, we had a substantial number of people with chronic conditions, and we would be able to say something about this group. For the second cycle, we are reconsidering whether we should lower the threshold, but that's an ongoing discussion. Well, as you can imagine, living with 2 or 3 chronic conditions, even 4 or 5, it happens quite often, can be a significantly complicating factor in people's life. So over 70% of the people who live with multiple chronic conditions, for example, they take at least 3 medications, and more than a third take 4 medications. They also see different healthcare providers. So in some cases, it can really be almost your second job to be chronically ill, because it requires a lot of management, coordination, and so on. And as you can imagine, things can easily go wrong if they're not properly organized. Then a little bit about the chronic conditions that we looked at. Because we could not go into the medical records, but actually also, even if we could have done that, we shouldn't do that, because we would have a major registration bias due to different systems, different countries. It's not as simple as that. So it means that the chronic conditions are self-reported by people. We provided them with a list that has been validated for lay people. So it's a rather broad categories of which you can assume that people know. They might know not exactly what type of heart condition they have, but they know they have a heart condition, right? So as you can see, high blood pressure is the highest scoring condition. You could have discussions about whether should you include it or not. We did, because, and this is also why we talk about conditions and not about diseases, because high blood pressure is a significant risk factor that needs to be managed in primary care. So it does come with a lot of work in healthcare, and it's definitely sometimes managed better than elsewhere. So here you get an impression of the first 7 conditions. We had a few more which showed very low percentages, like kidney disease and so on. There's also quite a gender difference. So as you might know from the literature, it's traditionally like men scoring more often on hypertension and cardiovascular conditions, women more often having arthritis or mental health conditions. So there's quite a bit of a gender gap. Then let's take one of these 10 indicators, and one that I find very interesting because I think it illustrates very well the idea behind PARIS. It's called social functioning. And this is typically something that is not normally registered in a clinical database. But if you look at people's life, it's extremely important. At the right, you see the question that we ask. So please rate how well you carried out usual social activities. So it means at work, at home, being a parent, a child, a spouse, employee. So as you can imagine, this is a major factor in everyone's life. And what on the vertical axis, we see the percentage of people who rate this positively. And the breakdown, the 3 groups, is the 1, 2, and 3 or more chronic conditions. Well, what all countries have in common is that with each additional chronic condition, you see that this percentage gets lower. So it does. This is a good illustration of how living with multiple chronic conditions does have a major impact on people's life. The red arrow is Switzerland. So as you can see, the overall level social functioning is quite high in Switzerland, but like in other countries, you see this, particularly when you go from 2 to 3 or more chronic conditions, you really see a drop. And of course, this is also interesting international comparison that you can see that it differs quite a bit between countries. However, it's not just many chronic conditions you'll have. It's obviously important what kind of conditions you'll have. And we found that particularly having mental health conditions are one of these, if you have multiple chronic conditions, and one of them is a mental health condition, this has an even bigger impact. So now we're looking at two groups, and both have multi-morbidity, but the ones on top do not have a mental health condition, and the triangles, they do have a mental health condition. In other words, even people with multiple chronic conditions that are physical and generally score quite positive on social functioning, but the mental health condition has a negative impact. Also with Switzerland, although you can see that even this group scores around 70%, which is still relatively high if you compare it with many other countries. Then another part in our flagship report is dedicated to inequalities. So how do outcomes and experience vary between different groups in the population? And one that I would like to show to you is the one about gender gaps. So here we look at mental health and physical health, and the horizontal axis here shows a PROMIS score. So it's a PROMIS scale. It's an internationally validated scale, one for physical and one for mental health. And the bars represent the score of women minus the score of men. And as you can see, the right part of the graph is empty. If there would be a bar there, it would mean that women score better than men on physical or mental health. So the first conclusion is, in all cases, in all countries, whether it's mental or physical health, women score lower on these skills than men. And this is what we call the gender health paradox. So we all know that women usually get older. They have higher life expectancy in practically all countries. But if you look at how they experience their own health, it's usually worse than men. So this is obviously age controlled. So we're looking at similar age groups. Switzerland also here is quite high in this chart, which means in this case that gaps are relatively small, but they also appear like in most other countries. A similar thing we did with incomes. We compared high incomes on physical health and mental health with low income groups. And also here, Switzerland is a bit on the top of the graph, meaning that also here the gaps do exist. Same as with gender, in this case, it's clear that in every country, the scores are always in favor of people with higher incomes. This might not come as a surprise, but maybe good also to realize that this has been controlled for education. So the education factor has already been taken out, and what's left is an income effect. And also, this exists in Switzerland, albeit that it's relatively small compared to the OECD average. Then something about healthcare spending. Because given that Switzerland has so many positive scores, a simple explanation that I often heard from people who said, yeah, obviously, because Switzerland is one of the richest countries in the world. So they can afford to build a really good healthcare system. So it's no surprise. Well, it's also not coming as a surprise that Switzerland is, as you can see here, among the big spenders. Right, so health spending per capita is relatively high. US is always a quite extreme outlier in charts like this. There, it's even higher, but particularly if you look at compared to other European countries and so on, Switzerland is definitely one of the biggest spenders. So that's the horizontal axis. From one is the average among the Paris countries. If you're on the right, it's a higher spending, at the left, or lower spending. The vertical axis, we look at experience quality of care. So it's just one indicator, but it's pretty indicative for several of the other indicators. So we ask people, how did you experience the quality of the care that you received? So what you can see here, there is clearly a relation between health spending and how people experience the quality of care. And in general, it's positive, but it's not so straightforward. So what we do see that there is one quadrant here is empty, which means that if you're above average spender, there is no countries that score below the average on experience quality. So there is a relation. However, if we look at Czechia and Slovenia, for example, Czechia scores comparable with Switzerland. It's maybe a little bit lower, but it's quite a comparable score on the experience quality of care. But Switzerland spends almost twice as much on healthcare. So I'm not saying you're wasting your money, but it's just to illustrate you cannot solve any problem with just throwing money on it. So it's not a given that if you invest more, that everything would always continue to increase at the same pace. So there could be a sort of that diminishing returns maybe. But as I said, we're looking at one outcome indicators. One experience is obviously not covering everything that's going on in the healthcare system. But just to say spending more doesn't necessarily mean that everything is getting better. And some countries might spend their money very wisely. A similar comparison that you can see here is with workforce. So here on the horizontal axis, we ordered countries from by the number of doctors and nurses per 1,000 population. So Switzerland, again, here is on the very right. So you have a pretty good coverage, quite a density of workforce in terms of doctors and nurses. And there is a small but clearly linear relationship with average well-being scores. So countries who have a bigger workforce have also higher well-being scores on average. Well, then I'm not going through all of these 10 indicators, but you can find them all in the report. But if we take a step back and then reflect a bit on so what are the things that really matter to people? What are the bigger topics that can really make a difference in the care for people with chronic conditions? Then we concluded that there were three main factors. And well, it might surprise you, but these are not very fancy technology or that kind of thing. It's pretty down to earth, easy to understand concept. So the first one is time. The time that you are able to spend on patient, the time that you can take for a consultation and so on. So I will show you a little bit more about that. The second is tailored care. So to what extent is the care really tailored to the needs of the individual? Is it the patient that needs to adapt to a system, or is it the system that is serving the patient? So think back of these people who might be living with 3 or 4 or more chronic conditions with all these medication, different healthcare providers. How well is this organized around their needs? And the third one, what we call trouble-free. And this is in a way related, trouble-free and safe. Given that there are so many things going on around this patient, it can be, apart from the health outcomes, it can be a challenge for patients to navigate their way to a quite complex system and understand everything what doctors tell them, what they're supposed to do themselves at home. So trouble-free is how smoothly is everything organized for the patient. And I'm going to show you a little bit more about these three. First, time. And these are different elements. First of all, the length of the relationship. So if the family practice is a sort of cornerstone of family practice, that you build a longitudinal relationship between doctors and patients. And what we see is the longer people are with the same primary care provider, the higher the trust is in the healthcare professional. Well, what you can see here in this graph, that in general, people have a very high trust in their primary care professional. That is actually always the case in all countries. But if they are longer with the same primary care professional, you see that the level of trust increase. But you can have discussions about causality here, because if you don't trust your primary care provider, you would be more inclined maybe to change. So that's also a factor here. But bottom line is that investing in longitudinal professional relationships goes hand in hand with trust. People also tend to report better quality of care when they have been with the same professional longer. And well, in most countries, more than 40% of the people have been with the same primary care professional for less than 5 years. Switzerland, again, here is doing pretty well. It seems that the doctor-patient ratio are relatively stable, and more than, as you can see, more than 60% of the people in Switzerland, the patient, have been with the same primary care provider for more than 5 years. Another way of looking at time is waiting time, because in that case, you don't want it to take too long. So how fast can people get an appointment if they need it? And we ask them the difference between same or next day. It can take up to a week or more than a week. Something that differs quite a bit also between countries, and also here a clear relation with trust in the healthcare system. If it's they can get an appointment quick, then you see that the level of trust is higher. And then lastly, about the care, the time element, we're still talking about time, is the time that is dedicated to the patient during one consultation. What we know from the literature, this is not coming out of Paris, but it has been reported in the literature, longer consultations are often better consultations because you have more time to listen to patients. Patients have more time to express themselves. And that differs also quite a bit between countries. And you see that in more than half of the countries, more than 50% of people with multiple chronic conditions are managed in practices with scheduled consultation time of 15 minutes or less. Or particularly if you live with multiple chronic conditions, that 10-minute consultation is quite short. In Switzerland, it seems that consultations are relatively long. So the majority of the patients, almost 80%, has consultations of 15 minutes or more. So that's great. Then the second element that I mentioned, what we call tailored care. So the overall conclusion that Switzerland is scoring pretty well, most indicators, still stands, and it's not to be expected that this has been heavily affected by this bias, but it should be taken into account. Another thing is, Paris is about actual experiences. You can only ask people about their healthcare experience and the outcomes if they had healthcare. So they need to have access and be actual users of care. So it's not so much a bias, it's just a matter of scope. So it's not a health survey of the population. No, it's a primary care users survey, which means that there might be a part of the population not included in the survey. And this is also being explained to me by actually the Swiss team that, well, it looks all pretty great, but you need to realize that out-of-pocket payments are relatively high. And we also see that in our OECD data. And in Switzerland, it could be people who have avoided care and therefore not being sampled. However, we looked into it, and what you see here is percentage of people facing access problem, according to Eurostat, and on the vertical axis, percentage of people facing access problems in Paris. Because we did ask people, did you have problems? Have you avoided care because of cost, distance, and so on? And we see a clear relation between the two. So this is encouraging. It means that even when we know from this country there are more access problems, there are also more access problems in the Paris population. And I think this is because we didn't set the bar too high to be included. If you would visit your practice once in 3 months in Switzerland, you could have been included. In general, also Eurostat figures show that percentage of people, I don't want to downplay the problem for the people who do have these issues, but from an international perspective is still low. So lastly, Switzerland is one of the richest countries in the world. Well, that's no surprise, I think, in terms of GDP per capita. So factors affecting well-being and health, they obviously go beyond the healthcare system. Switzerland is a pretty healthy country, I would say, to live in, pretty healthy context to live in. Besides how you exactly organize primary care. However, it's too easy to explain all the results with, oh yeah, it's just a wealthy country. Because we look at OECD countries, they're in general quite wealthy. We have a few countries who even score a little bit higher in GDP per capita, Norway and Luxembourg. And you can see that this relation is not always so obvious. Luxembourg is scoring pretty well, but definitely not so high on all the indicators as Switzerland. So there's also maybe a factor that you would live up to. The stereotype is that the Swiss know how to organize things, right? So this is a factor. Apparently, the organization is also pretty good, and you cannot solve every problem with just throwing money at it. To sum up, does healthcare deliver? That's a big question where we started with. And well, obviously the answer to a question like this is always yes and no, but yes, it does. People with chronic conditions report better physical, mental health and well-being when healthcare is centered on their needs. There's a high level of trust. We see quite positive scores. But if you go to reports, look at the specific results, there's always enough to work on and to improve and to learn from other countries. People with multiple chronic conditions in general, in all countries, including Switzerland, they need better support because particularly the thing with multimorbidity, we see that most healthcare systems are not designed to serve people who have multiple chronic conditions. Many elements in healthcare are still designed on a sort of condition or organ system by organ system approach. And we could do better. Digital technology can play a bigger role. Think of the exchange of medical records and so on, but also using online tools. We didn't talk so much about it, but there's a lot of room for improvement there. And continue to listen to patients is important to transform healthcare, because I strongly believe that it is necessary to continue measuring patient-reported outcomes and experiences also for policymakers, because if you want healthcare to deliver, you're flying blind if you're not measuring it. With that, I hand back to the chair, and I'll be happy to take any questions.
Thank you very much, Michael, of this clear overview of what this important and I think one of the first international survey to go ask patients in primary care, so which are really hard to get to reach with this survey. Before opening up for questions, I just wanted to add maybe 2 remarks on how the survey was conducted in Switzerland. So you highlighted that the methods we used to select patients was slightly different than the other countries. So indeed, the patients were invited to participate when they came to the primary care practice. In theory, we asked practices to distribute the invitation to everyone, but we cannot exclude that there might have been a bit of a selection bias from the primary care practice of not distributing the invitation maybe to patients that they thought were too ill to complete the questionnaires, or maybe that they knew they were more difficult, that they would not respond. Anyway, so I think we need to add that there might be some selection bias in the patients in Switzerland that could explain maybe partially about our such good results that we have. The other remark was you asked a question about, you were surprised about Switzerland not being electronic exchange, that it was quite low and that we did have some good results on coordination, but without this exchange. I think most people in Switzerland know that we we still do not have a unified electronic patient record. So this is a big, big issue in Switzerland. So I think this explains why there's not this exchange happening more often than the 50% of what primary care practices say. But we see that it did not have such a great impact on the way patients perceive their coordination. So at least that is good. The last maybe comment I wanted to make is you told us in the beginning, I think the confidence in self-management is one of the aspects in Switzerland that was lower in your radar graph. And I think this is something that we can work on in Switzerland. As you said, there's a lot of good results, but this is really something I think that Switzerland can do better. So if you have questions, you can either use the chat or raise your hand with the WebEx tool, or you can open your camera if you want to talk.
Shall I stop sharing my slides?
So we can see. So questions, anyone? Well, I had a question. I was just wondering, so as you said, so we deviated from the protocol, some other countries as well, either selected patients differently. At the OECD, are you going to look more into these, the impact of these different methods on the results? Is this planned?
Yes, good point. You also need to realize that this is the first ever cycle, right? The first ever international survey. And from the beginning, people have told us, well, this is going to be really, really challenging, right? So our first purpose was to get as many countries on board as possible. Of course, we want to make it as comparable as possible. We want to make it as reliable and so on. But we also realized that some countries are not yet ready to fully implement it following the standards that we have. So rather than imposing a very strict standard and then ending up with maybe 5 countries, we rather have 20 countries and incorporating, accepting that there might here and there a little bit of a bias or differences in design. If you go into the report, you will see that we have one quite comprehensive meta chapter where we also explain this in detail. So we're not hiding anything. Having said that, for the there's a bit of the paradox. Many countries ask us to adapt to their circumstances, to change a little bit. And on the other hand, countries are saying, well, international comparability is really important for the next cycle. So when we move into the next cycle, we're going to converge a little bit more. We're going to get a little bit stricter because now countries have already done it once. So we know that it's possible. And well, we are an international organization. So in the end, countries are in charge, but we are going to be a little bit stricter and going to push a little bit more on the technical standards to avoid these kind of issues. By the way, I saw that Emma also raised her hand and now put it down, but just not to miss that question.
Yeah, okay. Thank you for replying. I think Isabel just wrote something on the chat saying that if there will be adaptations to the methods for the next round, and you just said there will be, so to make the countries more comparable.
Yes, absolutely.
So Emma wrote her question. I can read it. I think it is interesting that patients with more chronic diseases are not well treated. I think we have to define for complex patients better pathways. LAMAL in Switzerland is the health insurance, does not fully recognize coordination time. So I think she refers to the fact that we cannot in Switzerland you cannot bill for the time it takes to coordinate the care for your patients.
Yeah.
And that this is the big, I mean, as you said, the multimorbidity is the next big issue that will arrive in this population.
Yeah, I think it's important to realize that multimorbidity is, well, if you would go to a typical clinical trial article, for example, you'll see, okay, we're excluding people with comorbidities, right? Very understandable that you're doing it, but it's often seen as a sort of like as if it's a very specific group. But the reality is, yeah, above the age of 45, this is actually the majority. So 52% of the people have multiple chronic conditions. That includes hypertension, but hypertension often coincides with other conditions. So the bottom line, it's a major phenomenon, and for primary care providers, it has become their core business managing people with multiple chronic conditions. This is also because of the life expectancy that has been increasing spectacularly in the past decades. But this goes hand in hand with more and more people that live longer with multiple chronic conditions, which means that we have more complex situations. And yeah, it's true. We think we're not well treated. That's maybe a little bit too bold, but I think a problem is that most of the fundamentals of our healthcare systems were designed in the 20th century. They were designed with a sort of a curative mindset. People would get in as soon as they're sick, and then you cure them, and then they can go. But the reality now is people live maybe for decades with multiple chronic conditions that they need to be, they're never going to be cured, but they need to be supported in a way that they can then live their life as well as possible. And yeah, we all know about this like problem of siloed system. You go to different healthcare providers, they get different type of medication, they give you advice, and they do not necessarily talk with each other. So, and this is something I think that is really important, and that all countries can invest in.
Do you have from the flagship report? I can't remember exactly now. Did you get insights from countries that do better, that have some solutions to how to take better care of these patients with multiple chronic conditions?
Yeah, there are countries. I mean, it's difficult now to name them, but there are definitely countries who are further with chronic care management programs or doing more to facilitate this. But also and if you look in the literature, it's still quite difficult to put your finger on what really works and what not, because it's a situation of many flowers blooming. There are a lot of initiatives with good intentions that do not necessarily provide tangible results. But yeah, I think there are, you can see that in some countries they are quite far with this kind of approaches. And frankly, my impression is that Switzerland is also one of them.
Emma, do you want to ask another question to Michael? Or?
Yeah, now in some cantons we have a change of healthcare policy, and they're trying to work on per capita instead of paying by each acts they're doing. And I was wondering if you think that will be helping us to go to primary care in terms of prevention and not in waiting that people are getting sick.
Yeah, well, absolutely. There's a lot going on in this domain. I mean, we have already, several initiatives out there with what we call population management, and this is actually the next step in the Paris. We stayed away a little bit on how should you pay for care, but also I think what I said, that how systems are structured. Part of that is also how healthcare providers are paid for their services. So investing in prevention does not really pay off financially. I mean, you're not usually not rewarded for investing in prevention. You're rewarded for curing people, like for operation, for hospital admissions and that kind of thing. That is what health insurers or payers often pay for, and not necessarily prevention. So I think you touch on a very important topic. I think more clever ways to pay for healthcare are needed, because the standard pay for healthcare is still, I would say, not very, it doesn't make that much sense to just pay for more services if you don't know whether these services do necessarily result in better results for patients. And well, it has become a little bit old now, but from 2018, I think we published a waste report at OECD where we concluded that roughly 20% of the resources are wasted in healthcare in most OECD countries, which means they're resulting in not any benefits or even harm for patients. So, yeah, I think finding clever ways to invest in healthcare, rewarding healthcare providers maybe to keep people healthy rather than only curing diseases, I think it's definitely important.
Okay, well, it's already time, so I just want to thank you again for presenting the Paris survey with the most important results, the different methods that were used, and I personally think that this is really important. That, as you said, we should continue to measure these prems and proms, to have patients' opinion about what they think about their care, to have this. And then at regular intervals, so we can see how care is moving towards which directions. And as we all know, if you don't measure, we don't know how good we're doing. And this is why I sincerely hope that Switzerland will continue to participate, as well as many countries as possible. Well, thank you again for your time.
Thank you very much. And thank you all for listening. It was a pleasure.
Thank you. Thank you all. Bye.